as we run up to lunch, we've got a really important little section here. One of the difficulties, I think, in the mental health space is actually getting people to work together. We saw it in the panel and whatever. It's got to be a collective response, and I guess one of the organisations that has really worked hard at a collective response, bringing a lot of organisations together, is Suicide Prevention Australia. And I'm delighted that we've got Sue Murray with us, who's the CEO. Sue's been in this space for about 25 years, working and trying to bring people together. And what they wanted to do, and they found out that we're having a conference, is says, can we launch our position statement on suicide in the workplace at this conference? We're really honoured that they chose to do that. And so I'd ask you to give Sue a really warm welcome.
Thank you very much, John. And thank you to Mates in Construction, IncoLink and AusHelp for allowing us to be here today. It's terrific to be part of such a gathering. I'd just like to ask, before I launch into this program, before you got involved in the area of suicide prevention, how many of you thought that the majority of suicides occurred in young people? Well, you're not alone. You're not alone. 18 months ago, I decided to throw my hat in the ring to move into the area of suicide prevention. The 25 years is actually in the not-for-profit sector, most of that in cancer. So this is a new field for me. And like any good candidate, I decided I better do a bit of research around this area just in case I got to an interview. And in doing so, I have to say, putting it mildly, I was stunned, because what I found was that the majority of suicides occur in working age adults, and 4 out of 5 of those are men. I, like most people I talk to now, was under the assumption as a layperson that young people were where the major problems lie. So I've been on a little mission since I started about 15 months ago now to bring suicide prevention in working age adults onto the public agenda. We started this by making it a primary part of our national conference, which we held in July. And today we're going to launch our position statement, Work and Suicide Prevention. We also want to ensure that we put very high on the public agenda men aged 35 to 50. And Sally talked to you about that ripple effect that a man in the prime of his life can have with young children, with ageing parents, with work colleagues and responsibilities. So we believe that this is a very important area to have on the public agenda. So Australian employers do have a role to play in suicide prevention. The World Health Organization says that the workplace can directly influence the physical, mental, economic and social well-being of workers, and therefore their families, their communities and our society. So it's an ideal setting in which to deliver health promotion and in which to reach large numbers of audiences. But it also makes very good business sense. Now, there's not a lot. I think that we're going to hear more about the economic analysis later on this afternoon, aren't we? But there's not a lot of work that has been done that has looked at the total cost to the community that is impacted by suicide. But in the Senate inquiry in 2010, there was a reasonable guesstimate that was done, which showed that the cost to the community of suicides and attempted suicide was in the vicinity of $17.2 billion annually. Superfriend and its partners, the Australian Group Life Insurers, said for known causes of death, where suicide is the known cause of death, Their members have paid out $100 million in 2012. And some of those group life insurers have indicated that 20% of death claims are as a result of suicide. Medibank Private showed that stress-related mental illness is costing the Australian economy $14.2 billion annually, and 3.2 days per worker per year are lost to stress from mental ill health. Safe Work Australia says that mental illness and mental ill health is the highest cost in workers' compensation, and that's primarily due to the long periods of absence that will be experienced from the workplace. So it certainly, from a financial perspective, makes good sense for business to be thinking about suicide prevention. But people are our business, aren't they, ladies and gentlemen? So people have to remain at the heart of all our efforts. Suicide cuts lives short and leaves an indelible mark on those who are left behind. So how will our position statement help you? Well, first and foremost, up front, you will see recommendations for your workplace to implement policies and programs. But then we go into a more in-depth review that will help develop a case for change for your workplace. We're looking to provide some understanding of the magnitude of the problem, looking at the risk factors, particularly around occupations, the evidence that will support your decisions about programs and activities to use in suicide prevention, the policy frameworks that can support suicide prevention in your workplace, and of course there are also resources that you're able to access and when you may need to respond to a suicide, and if you need help in implementing the recommendations. There is no doubt that suicide is a complex social issue. The causes are many and varied, and we don't have standard guidelines for how to prevent and for prevention and early intervention. It's not like heart disease and cancer, where we have really solid research that actually tells you what is the best way to diagnose and treat these conditions. In fact, many of the risk factors are not health-related per se, but socially driven. There are occupations where the workers have elevated risk of suicide. So in low-skilled jobs with labourers and cleaners, we know that machine workers and ship's deck crew have increased risk of suicide. Farmers, service workers such as the police, and skilled tradespeople, builders and electricians. We know that working conditions will impact on suicide risk. Lack of time, low levels of control over work schedules, poor work relations, lack of space, and that relentless productivity drive, more, faster, cheaper. Unemployment is a risk factor for suicide. One European study found that a 1% increase in unemployment will yield almost a 0.8% increase in suicides. In the United States, a similar study showed almost a 1-to-1 relationship between unemployment and suicide. Australian research has shown that in more prosperous times, the longer people are unemployed through an unplanned unemployment, then the greater their risk of suicide. And as you would anticipate, people who are unemployed for longer a period of time than those who are unemployed for a short period of time often have an increased risk of suicide, generally finding themselves having reduced financial and security status. And workplace bullying. It has amazing impact on individuals' health and well-being. We are hearing, we don't have evidence, but we are hearing more about the role that bullying has in cases of suicide. And Safe Work Australia has developed guidelines around assisting employers deal with this issue. What works is a bit of a problem for us in suicide prevention. There isn't, there is, I should say, a great deal of a paucity of research on what works. However, the good news for workplaces is we actually do know that there are some very effective things. Certainly, the evidence to support training of gatekeepers so that we can identify and direct vulnerable people and colleagues to appropriate pathways for support. And there's also good evidence to show that increasing both the availability and the access to care will also reduce the risk of suicide. In Montreal, the police force set up a multifaceted program that involved these sorts of elements, and they had, over a 12-year period, an 80% reduction in suicides in the workforce, in their particular workforce, from 30 per 100,000 people to 6 per 100,000 people. So it works. We also here, with our own Mates in Construction, IncoLink, Oz Help Foundation, are looking at multifaceted programs. And through Mates, we know that 44,000 people have been exposed to their program, and that they've succeeded increasing awareness and help-seeking behaviours. So what do we need you to do? Suicide Prevention Australia is leading the National Coalition for Suicide Prevention. We're taking a new approach. This approach is called Collective Impact. Collective Impact is a framework that brings together governments, business, and the community sector organisations to design a common agenda, shared goals, measures, and reporting to address complex social issues. In our case, it's about suicide and suicide prevention. We have a very simple agenda, but it is not easy, ladies and gentlemen. Our agenda is to halve suicides over the next decade. Halve suicides in Australia. So we want you to be part of that agenda. We want you to join us in this endeavour. So the recommendations that are in the position statement address the three sectors. For workplaces, we want to see that you promote a leadership culture that supports mental health promotion. Provide workspaces that are conducive to mental health. Ensure there is good space. Make sure that job descriptions are written with the person in mind as much as the role. And ensure that there's good communication to employees about the availability of pathways for support. And be prepared should a suicide occur in your workplace. Know what to do. Know how to respond. Know who to follow up with. For governments, we're calling on governments to support system change through relevant policies and procedures, to invest in job creation, to train frontline workers, particularly those who are working with the unemployed, and to invest in research so that we can understand better the relationship between work and suicide and the sort of programs and activities that we should be delivering. And SPA is taking an active role in influencing government, businesses, and work-related entities to adopt the recommendations that are in the position statement. We're promoting best practices in suicide prevention. We're advocating for the standardisation of data, which you've probably heard a lot about already, so that it is more consistent, accurate and timely. And we're calling on the inclusion of work factors as a standard in any psychosocial autopsy. That is understanding whether work had a relationship to a person's suicide. And we're seeking to increase funding for research. So, in launching this position statement on work and suicide prevention, I challenge you. I challenge you to engage your employers and your work colleagues to put it into action. I invite you to join the National Coalition for Suicide Prevention and to join a team that is working to save more than 1,000 lives every year. Thank you.